I'm Laura Whittingham. I'm a fourth year medical student at Nottingham University. This is a short presentation on indocyanine green enhanced imaging. A quick recap on visualization, which is it's a key aspect of minimally invasive surgery. It's one of the three core pillars along with CO2 insufflation and instrumentation. The early advances in visualization were focused on improving image quality and achieving stereoscopic vision, which is similar to seeing with two eyes. Recent enhancements have worked to see beyond what can be seen with the naked eye through things such as optical filters, so seeing with a narrow band of light, and also the use of fluorescent dye, ICG, which is the focus of this talk. This slide's a quick comparison between the two main developments, which is optical filter and ICG fluorescent dye. On the screen here, you can see an image which is likely to be an endoscopic view, a colonoscopy, and this is what the operator would see. So when they're investigating to see whether there's potential for the polyp to be benign or malignant, it's very difficult to tell just from this sort of view as to kind of gauge what the risk may be. This is where the optical filter comes into play. So you can see on this next image, the operator can get a far greater sort of detail of view as to what the cell organization is like within the polyp and whether it looks particularly concerning or whether the structure's far more kind of benign looking. Now on to the ICG fluorescent dye. The image in the top right is from laparoscopic surgery. And if you take a look at that and try and figure out where is the lymph node, it's quite difficult. You may think, oh, perhaps it's hidden in the fat, but it's hard to know. It's even more difficult to know where the lymph channels may be. However, if ICG dye is used, it really changes the game. So here you can see ICG has highlighted the lymph node in green, and the channels can also be seen in green. So what is ICG? ICG was first developed by Kodak Research Labs towards the end of the Second World War, and in 1955 it was used for near-infrared photography. It's a water-soluble, relatively non-toxic iodine dye that can be cleared rapidly by the liver. And for this reason, it was quite quickly adopted by the medical profession and was FDA approved in 1956, so quite a while ago. It was used to measure cardiac and hepatic function, so looking at kind of blood movement through the body, and has been used by ophthalmology since the 1970s. But really the use of ICG was limited until relatively recently because of the size and scale of the equipment needed to visualize it. Whereas with the introduction of improved digital imaging, this has meant that there are broad applications for ICG. So how does ICG actually work? Well, it's really quite clever in that it's a fluorescent dye that only fluoresces, so emits light when it's subject to a very narrow band of near-infrared light. And this near-infrared light can penetrate into tissues by about 5 to 10 millimeters. So as you can see on the diagram, you need a source of light which will be shining towards the tissue. It can penetrate into the tissue, and once it hits the ICG, this fluoresces, and this fluorescence can be detected by the camera. And at the bottom here is what an image would look like if you use the infrared light source alone. It's quite a simple image. And then if you go on to kind of look at this slide, this illustrates how it's combined with the normal white light imaging and the ICG near infrared imaging. So what you can do is you can lay the two images on top of each other, which is the central image here. And you can flick between having ICG mode on and off. So using the standard normal white light imaging. The advantages of ICG is that it, as I mentioned, it can penetrate 5 to 10 millimeters deep into tissue, so you can see beyond what you could see with the naked eye. It's also got a very good signal to noise ratio because the light, the near infrared light, only fluoresces sort of the ICG dye. There's nothing within the body that would fluoresce when it's subject to this light. The dye is also rapidly cleared by the liver. And as you could see on the previous slide, it can be overlaid onto a white light image. In terms of contraindications, because ICG contains iodine, it shouldn't be used in patients with an iodine allergy or hypersensitivity to iodine. It should also be avoided in patients with hypothyroid syndrome or with thyroid adenomas, again, because of the iodine content. Because it's hepatically cleared, patients with liver disease should be avoided, as should pregnant patients. And the next slides really just show a range of applications for ICG. I'm not aware that they're commonly or routinely used, but as the technology has been developed, it's coming more and more into play. So firstly, it's used within gynecology as part of sentinel lymph node detection. So for cervical and endometrial cancer, ICG would be injected into the cervix, and then the lymphatic drainage could then be detected and use ICG to identify these sentinel lymph nodes. Similar with vulval cancer, it would be injected local to the tumour and used to identify the lymph node staining. It can also be used to clearly identify the ureters. So ICG would be instilled into the ureters by a catheter, and this is particularly helpful in colorectal surgery or complex pelvic surgery to reduce the risk of injury to the ureters. It has been trialled to diagnose and treat endometriosis. ICG is given intravenously, and because endometrial tissue has more vascularization, the endometrial tissue will grow, sort of be a darker colour green because of the neovascularization. A systematic review looking at the use of ICG to detect endometriosis suggested the results at the moment very inconsistent. And looking at the images on the bottom of the slide here, you can see with the naked eye, you can pick out the endometrial tissue reasonably clearly compared to the ICG enhanced image on the right, sorry. So looking beyond gynecology into more general surgery, it's used within bowel anastomosis to identify areas of poor tissue oxygenation or to clearly identify areas where blood flow has been stopped to the bowel. It can also be used to assess bowel perfusion before resection. And finally, it has been used in cholecystectomy, either by injecting ICG into the gallbladder, which allows the bile ducts to be clearly visualized, as you can see on the right-hand side of the slide, or it can be injected IV, again, put that into the bloodstream to visualize the cystic artery. Okay, in summary, this talk's provided an overview of recent developments in minimally invasive surgery image enhancement, looking at optical filters and fluorescent dyes. I've spoken about what ICG, or indocyanine green, is and how it works, and we've touched on the advantages and contraindications of ICG. We've then finished off with some potential applications of ICG in laparoscopic surgery, focused on gynecological surgery, but it is used more widely in general surgery. I think this is an area of exciting developments, particularly improving patient safety, being able to speed up operations, and just an extra tool to add into the mix. Thank you very much for listening. I hope you've enjoyed this brief overview.